Okay, good afternoon.
Working from home, but twice as hard. Jason Cunin has never needed March break more in his 26 years of teaching.
I'm absolutely exhausted. I was running on adrenaline for the first 2 months of this year, and then hit a wall sometime back in November, and I've been running on fumes ever since.
And now those fumes will have to keep him going a little longer after the province announced March break now won't happen until April.
I recognize that this is one more change in a year that has been challenging for so many students and our education staff who continue to work so hard. But it is one made on the best advice of public health officials.
Postponing the break could prevent travel for people and the coronavirus. And there's another benefit.
It gives us a little bit more time, first of all, to get folks vaccinated, especially those that are high risk. And it allows us to ramp up the testing strategies especially for the new variants that we're seeing.
That may be good for physical health, but teachers are worried about mental health too.
I'm infuriated. I'm absolutely infuriated by this. And it's not even just for me. The kids are exhausted. I'm exhausted. All of us are exhausted.
Teachers' unions say it's not like its members or even students were going to travel this year. They just need a staycation pronto. The Elementary Teachers Federation of Ontario has been inundated with complaints of burnout and frustration.
I would say to the Minister of Education, go into a classroom, do what our members are doing for another month beyond the schedule where the March break was scheduled. They are hanging on now as it is.
Okay, and Katie, this does come at a time when doctors are increasingly worried about variants and a potential third wave.
Yeah, the new modeling out today suggests that there is a threat from that variant that was first identified in the UK, which we know to be more contagious, and preliminary data suggests it is more lethal. And, there are fears that that variant could force numbers to soar here in this province, particularly because we are seeing a relaxing of some of the restrictions in some areas. And to get a sense of how dire that could be, here's a little exchange from the briefing today.
Am I missing something here, or is this presentation actually predicting a disaster?
No, I don't think you're missing anything. The cases will likely rise given the variants of concern. The need to keep that R down is really, really critical.
Now, that R refers to the virus's reproduction rate, which, of course, has never been as low as officials have wanted. So what's the answer? Aggressive vaccination and sticking to all of the public health measures we've been following since the beginning of this pandemic. Andrew?
All right. Thanks, Katie.